So what are some early warning signs that people should watch for before back problems really become serious? And I would say probably anytime you start having a back problem, it's serious. I don't know if there's a level of threshold of seriousness with back injuries, but what are the warning signs?
So the isolated back pain is quite common, right? When I do a long surgery, my back hurts. So that's quite common and it's very prevalent within the population based on the level of exertion. But when you start having radicular pain, numbness, or tingling down your legs, right? Or if we talk about the cervical spine, same thing. Isolated neck problems, okay. When pain, numbness, and tingling are shooting down your arms, but when you feel weakness, that's really a red flag. Like seek medical help, as soon as possible. But if there's an inciting event, right? If you do something and it immediately generates new onset back pain. For younger adults, it's okay to wait it out, rest, ice, do some massage in that area and see what happens. But the older we get, we probably should seek medical attention because this could be a fracture. So isolated back pain, in as much as it resolves in some, you should probably seek help if you're in the elderly cohort. But even in the younger folks, if it persists for more than, I can just say a week, right? If you rest for a week and it doesn't get better, the easiest thing to do is to at least talk to your primary care provider or go to an urgent care. You can always get a simple x-ray of your back to make sure there's nothing disastrous. And if there's anything concerning at all, then that's usually when a consultation to either a spine center or neurosurgery office is necessary. Because some of these things could start rather small, right? Something that could require a rather minimally invasive outpatient procedure. You wait 4 or 5 years, and now we're talking about a big complex surgery that keeps you in the hospital for a week.
And some of us have pretty high pain thresholds, so sometimes we can push through those things. It doesn't seem so bad, and then we get used to it. And so what really is bad just keeps getting worse and worse, and we're not really kind of perceptive of it. Would that be correct?
I mean, that's very correct, and we see that a lot. In as much as I work in a hospital, I hate going to hospital, but I would say it's good to know what you have. I see a lot of patients. I see more patients in my office that don't need surgery, that need just counseling, than the people that directly need surgery. And the reason being, it's nice to get it looked at, understand what you have, get educated on what you have, and get notified of the red flags. If you don't know what you have, then you really don't know what the red flags are. You don't know whether this episode of urinary incontinence is a sign of spinal cord damage or is this episode just because you were tired, right? But the more you know, the more you can essentially care for yourself and seek immediate help when that time comes. So I think the education is actually key.
And sometimes you have a physical therapist that points things out to you. And so when you were in that elevator, what changes did that prompt for you? How can exercise, mobility training, and those types of things help protect the spine as we get older? What did you start doing once that physical therapist said, "Hey, stand up straight"?
The first thing I did is when I'm at the sink doing dishes, I don't lean over. Right? Because it's interesting. Like every time I did dishes, my back would hurt. And I was like, well, that's why, right? I was standing the wrong way. And it's the same thing. So ever since that encounter, the way I stand in the operating room, the way I sit in the office, the way I carry myself around, I find myself sometimes doing that, like hunching over, and I have to just readjust and reassess my posture because I've seen a direct correlate with whether my back hurts at the end of the day or doesn't. So it's helped me, and I tell everyone there's no one that doesn't need physical therapy. Everyone could benefit from it one way or the other.